So I'm very pleased on behalf of JPOP to interview one of our authors. This is Professor Stephen Loy, who is a professor in the Department of Kinesiology at the California State University at Northridge. And today we're going to briefly discuss the recent paper published in JPOP entitled The Qualitative Analysis of a Kinesiology Student-Led Sustainable Exercise Program Targeting Underserved Communities. I'm very pleased to be talking with Professor Loy because some of our students had the opportunity to really benefit from the program. And the program we're talking about specifically today is the 3 Wins Fitness program. And so, Professor Loy, the first question I have for you is, how did you get the idea for starting 3 Wins Fitness? How did it come to you?
Well, the idea generated out of probably the last 15 years of teaching a research and exercise physiology class, talking about population health, and that we needed to own the solution to it. We've done the research, we know what's needed, we have the physical activity guidelines, and at that time we were hovering around 2,000 students within our department. And so we had an ample number of students. They lacked the soft skills in terms of graduation. It was a senior level class. They didn't have the communication skills, the leadership skills, critical thinking skills, all the things we talk about in the classroom, but yet we never really implement. We never really teach those skills. And so we've got a population health problem. We got 75% of the population not doing the strength and the cardiovascular work. We've got all of these students who need the skills to deliver the hard skills, the things that they learn in the class. And they also need to pick up the soft skills. So we have a problem and then we have a solution. So could we match those? And then within that, the recognition that if we were going to do something, it couldn't be the hit and run, do a research project and then leave the community. So it needed to be sustainable. We needed it to be scalable, ideally replicable, and then affordable. And so that was then the opportunity to take students, develop a program that they could get academic credit for or volunteer for, and that would allow us then to offer it to the community at no cost. So free to the participants, operating at no external, with no external funding to operate the program. So all the stars kind of aligned. And I remember when we first started, it was, is this an innovative idea? Well, I don't think so, because it's student internships. But then over time, it has seemed to not necessarily catch fire with all kinesiology programs. So maybe it is innovative.
If not innovative, certainly low-hanging fruit for programs. Okay, so what has been the most rewarding aspect so far from this program?
I would say 2 things. Number one, it worked for the students, and seeing those students over the past 11 years leverage their experience in the program into either getting into graduate school, obtaining job experience, because now they had those soft skills and they had picked up the skill sets that others didn't have. It became a differentiator for them in their interviews. And it was clear that where they were progressing to was by virtue of what they received. So student win was number one. The second was the participants. So having the program over 11 years at this point, having people in the program that were there at the very beginning, and certainly participants that have been there 5, 6, 7 years, seeing their world open up. And that's one of the things that I talk to them about is don't let your world contract as your physical activity and your strength diminish. Keep your world large. And so seeing those participants stay healthy, take on new things, both those have been the most rewarding. So our 3 wins are our students, our participants' health, and then community health. So those 2 are top of the list.
quite the public health message you're putting out there. Um, so let me ask, you mentioned sustainability. How easy or how difficult has it been to scale up this program?
One of the
Both
things that
horizontally, both horizontally to other universities and then vertically perhaps, up to government funding levels.
one of the things that I saw with our own program is how easy it was for us to scale up, that we could do it. And so if we could do it from Tall State Northridge, then why could not any other university do the same program? So the ability to scale, we were at 16 parks or locations at our largest. So that was possible. So I consider that, okay, it can be done in one institution. Are we special? Are we unique? I don't think so. We have kinesiology program education, much the same as around the country. Scaling it horizontally through other universities, that became more of a challenge, in part because my impression was that students could run the program, and they do. They lead it, they direct it, they deliver it. But then again, what I found out over the first couple of years is that it does need a faculty member. So there needs to be a faculty member who is also passionate about improving population health and utilizing this model. And we don't have a lot of faculty that fit that at this point. Over time, we will, as we get integrated kinesiology public health programs that are starting to produce doctoral candidates that are thinking that way. So I think that's the future. Horizontal, we can do that. Through government, right now, I'm working through LA County Public Health. That'll be my first stop. And we've got to capture it. It's got to be step by step locally. And then we get a little bit bigger locally. And then from there, then we start to have that overreach. We have the quantitative data. We have the qualitative data that suggests it work. And so if we can do it within LA County, which is very large, a lot of people, a lot of underserved populations, then why couldn't it be done in other areas? The thing to understand is that the Three Winds Fitness model is perfectly adaptable. You adapt the principles to your specific population and their challenges.
So, for example, in the Northeast, winter is always a challenge. So whereas public spaces, outdoor spaces can be used, sometimes they can't be used. And so the program is absolutely adaptable to different settings. Is that correct?
Well, in fact, that was the concern when I presented this at the American Kinesiology Association. They said, well, you're out there in LA and you got all the sunshine. And my perspective is that, yeah, but when it rains, we have challenges. In fact, the areas where it's cold, you have a built-in environment. You create the indoor facilities. So actually, you're probably better suited to have this program than often we are. So it can fit in any population. But again, it goes back to the faculty. Goes back to the faculty who knows their environment, knows their facilities, and says, okay, how do I adapt this model to what we have? And having been in a number of different churches, parks, not all parks are created equal. Not all churches are created equal. And we've even been in middle school. You adapt to what you have. What you have to do is increase physical activity. What's our facilities? And that's that critical thinking component that comes in for the students then. It's not always going to be ideal. Make it work, because we know that that's a problem that we should own. We should own population physical activity. We have the solutions, and we should be able to have the creativity to make it happen.
Beautiful. One last question. What's your soundbite? What's your public health practice mantra for others, wanting to carry on a program like this?
I think the mantra is that public health and kinesiology need to work together. I understand that public health is not necessarily programmatically oriented. They tend to be towards policy. But what we can do is we can take the train the trainer model, we can go into communities and we can say, okay, what is your situation? Here's what you need to do, and here's how you can do it. Case example is right now, we're working with a Japanese American community center. And what they have is they have an activity program, but they lack a strength component. And that's because the participants themselves deliver the program, and they learned what to do 10 years ago from a coach or a physical activity person, and that person went away. And so the program hasn't changed in 10 years. And so we are going in and we're saying, all right, here's your daily dozen strength activities that you need to do these daily. And we're developing a program, and this is in conjunction with LA County is talking to them. Can we create a QR code that our participants can go in on, and they can log in their steps that are on their phone? Most are carrying the smartphones now, and they don't have to have a watch or a wearable. They can capture that QR code, put in their steps, check off the box, I did my daily dozen, and we know where they are. We can capture that data eventually. So I think it's public health and kinesiology working together and realizing that together we can address this population health problem.
Oh, well done.